The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to the weekly broadcast of Ageless Health with yours truly, Dr. Tom Roselle. I'm glad that you're here. We got a lot to talk about today. Things that are going to affect you like right now, and you got to pay attention to it. What are we talking about? We're talking about your subtle springtime allergies. And for some of you, it's not so subtle. It's not so subtle. We're going to walk you through it. I'm going to tell you what you need to do about it. And that's all leading up. And I want to let you know to begin with, on April the 15th at the Roselle Center in Fairfax, those of you around, you're invited to attend. We're going to be talking about springtime allergies, but more importantly, what you can do about it so they don't continue to bug you forever and forever. It's not okay, right? You want to have breathe easy attitude about everything that happens in the springtime. You want to enjoy the flowers. You want to look outside and smell the air and the beauty of the grass and so forth, instead of being plugged up, feeling like garbage and don't want to go anywhere. But let's get into the subtleness of it, because already it's hitting. We've had a really, really different type of winter going into the spring. And when you see that kind of up and down, really cold, a lot of snow, freezing stuff, and then it goes to a warm day and a lot of rain, and you start seeing, the grass trying to get green and the flowers starting to bud out, and then it goes back the other way, you're setting the stage for things that you shouldn't have to worry about. And that's called not feeling really good and diseases and really impactful allergy reactions. What am I talking about? That I really want you to get it. I want you to understand that this is something that you can do a lot about. And so let's talk about some of the subtle signs. One of the most profound signs of springtime allergies is that you don't want to get out of bed in the morning. I mean, you are totally immobilized, and you do a little something, you want to sit down, you go to sleep, or you have no energy. It's called too pooped to participate. Well, it goes beyond that. It's like you don't have anything left inside of you to do much of anything. So if that's starting to happen, it's starting to creep up on you a little bit, you wonder why. You thought it was the time change that just took place. Not so much. It's more than just the time change. This losing an hour in the springtime, yeah, it throws things up, but just an hour, you should be able to recover from that pretty quickly. But everybody says, oh, it must be the time change. I am so exhausted. I am so tired. I can't think straight. Well, it's maybe more than just the time change. It might be the mold, that's coming out of the dampness of the ground. It might be the pollens that are starting to bud out. It's maybe some of the things that you've been previously exposed to on an ongoing basis, but you've never taken care of yourself enough to give you the immunological reaction. But we're done today. As you follow me through the program, I'm going to give you some things that can help. I'm going to give you some tips. And if you did nothing else but implement some of these things that we're going to talk about, I promise you that you'll feel better instead of going for the nose dope. We call them, like the old Afrin sprays and the steroids and, all the things that the docs will write just to allow you supposedly to breathe. Well, there's better ways of doing it. And when you go into the spring and you're having all these problems, let me tell you something. Here's the issue, that if you're reacting, you're not healthy. You shouldn't have these problems. So let's get into it. Let's talk about some of the subtle signs. And what are they? We said there's an abundance of all kinds of things happening right now. But because many of you are plagued with reacting to these things, your nose starts running, you start sneezing, your eyes burn, your skin itches, the congestion that feels like somebody is sitting inside of your head, like an elephant, the dark circles around your eyes, all of those things are subtle signs, and they come on slowly. All of a sudden you're itching your eyes, you're rubbing your eyes. All of a sudden, your nose isn't clear anymore. You can't smell anything. And it's not COVID, it's springtime allergies. Everybody thinks, well, my throat is sore and I can't smell anything. And guess what? That's seriously not COVID. You can get really sick with this stuff. So when we talk about the signs and symptoms of this time of the year, you really have to understand that number one, you don't have to live with it if you do something specific about it. And we're going to talk about specific treatment, particularly as we go through. And on the in-house program, when we do it, which is the ninth, you're going to get a lot of tools, a lot of different things that can help you. So let's do that now. Let's talk about those things because you need to know, right? You need to know what they are. You need to make sure that you're not going to suffer a bad another 3-4 months all the way into June when certain grasses and things start. But you got to be proactive and you have to look at the symptoms. And it's not about going out and taking steroids and things of that nature. It's about understanding what's really happened to you and your body. And once you get that, if you understand it, then guess what? You probably can do something about it. That's my thing, right? Let's figure out, be proactive. Let's figure out what the deal is. If you always start the spring with a wave of these symptoms, the itchy eyes, the sore throat, the runny nose, the itchy skin, the congestion, the coughing, the tiredness, as I said, which is the one that hits all of us. If you normally get that sneezy, stuffy beginning in early March and you start popping the meds and real quickly, you got a problem. It's probably called pollen and mold. And yes, it's mold. And if you typically have a mold problem, you go in the basement, you get all plugged up. This makes it 10 times, 100 times worse. So you might need just to keep the garbage out of your eyes and keep your eyes clear. That would go a long way to help you. It may mean that you got to change your clothes on an ongoing basis. Don't wear the same thing tomorrow. Throw them, wash them. I know it's a little bit, but these are little things that you can do. So you go to the doc and they give you the allergy shots. They don't really work. There's homeopathics that will do a better job, and you can get them like at Mom's Organic. You can get them at the different health foods. So you get them online, and they work much better. They go deeper. They begin to resolve the problem. You get somebody that does the work that the great docs at the Roselle Center here in Fairfax do, and they can desensitize you. It has to do with changing your environment too. Let me tell you, you've got to change a lot of the garbage that you put in your system. The only time that I would tell you to wear a face mask is when you're really in the throes of this mist, not because of COVID and so forth, but the pollen pieces, the mold pieces, the things that irritate you are big enough particles that a surgical mask can stop it from getting into your membrane. So you may want to think about it, but that's the only time. If it's a virus, they don't work. Trust me, if you still can breathe and you can smell things, they're not working. But these particles are big enough that it can stop, and then throw the damn thing away. You don't want it around you afterwards. So when you get these watery, itchy, crazy feelings in your eyes, there's a lot of just physiological saline drops that you can get and just put them in your eyes. There's some great homeopathics, and we get a shot today. I may tell you a couple of them if you stay with me long enough. The darkness. It looks like you got into the ring and you were beaten up and you got these black eyes. Like, what happened to you? You look horrible. Did you get enough sleep? You're probably not sleeping with this nonsense either. The headache is a stuffy, dull headache. It's just this pressure on your face and on your head. These headaches come from congestion in the membranes. They swell to try to protect you, and that's really where it's coming from. Remember we said a little bit of the rashing. It's an eczema, it's a dermatitis. These are things that tell you that you got a problem because the skin is your barrier, it's your protector. But if you don't have the wherewithal to handle the pollen and the mold and all the stuff that's blooming around you, you got a problem. 25 million Americans have asthma, and that's kind of crazy, right? But when you breathe in any allergen, including, it could even be your dogs and your cats and your pets around the house, but particularly mold and particularly pollens and particularly all the things that are coming off of your yards right now, that asthma is going to go crazy. Here's another one that you may not have thought about. When your nose gets stuffy, do your ears itch? your ears, these big old guys on either side of your head. Nothing on your face or the size of your face, really, when you're thinking about it, is safe from springtime allergies. So the whole face can be irritated. You get that stuffy nose, your sinuses feel like they're going to collapse on you. And these are all the things that come. And what do? You go get nose dope and you get the sprays to open it up. And instead of asking the question, what can you do about it? How can you fix it? So you can help when you're in the midst of it. We talked about, you can wear a mask if it's really that bad. It's the one time that you're in your car, don't wear the mask. Put your air conditioning, your filtering on so you can deal with it. Make sure that you're using your air conditioning at home. Wash your clothes, change your sheets. Don't sleep with the windows open. I know if you're like me, I like the windows open. I like it cold in my room. That's the way you should sleep. But listen, if you're not sure what you're dealing with, you're probably, unless you're really sick and you're running a fever, this is allergen. And we want to make sure that you have the capacity to resolve this thing. So let's get into, are there things, if you will, are there things that can make a difference? And the short answer is yes. There are natural products, but I don't want you to use them as a drug. What do I mean by that? Take this for that. I'll give you a couple of natural things that will help, but I want you to promise me something. I want you to promise yourself that this will be the last year that you suffer from this silliness. So before we get into the things that will fix it, let's talk about some of the things that you need to do to prevent it. Did you know that the nervous system is your primary defense mechanism against anything that affects the body? So think about your brain, your spinal cord, the 31 pairs of nerves that come off the spine. This is your computer system. And it signals, it's a power system in your body. It tells everybody what to do. And if the upper part of your neck is not positioned properly, you had a subtle car accident at one point, not a lot of pain, but they're not in alignment. So it's causing the nerves not to signal. If that's the case, your sinuses won't drain, your ears won't open, the eustachian tube feels like somebody's, you got an infection. It's not, it's just that the eustachian tube is closed, it's clogged up, and it's going to cause that back pressure, and it hurts. So if you find that, that you have this dull headache ongoing, it's usually the back of your head, don't run off and start, just throwing drugs at your body. Why don't you go see somebody that does my work? Go see a good chiropractor. Go see a good osteopath who does manipulative modes, somebody who does natural medicine, a good acupuncturist. And I think you may find that they can resolve the problem. And if you're willing to make some changes. And by the way, this time of the year, what do you want to do? You want to avoid things that will make it worse. What are they? They're like, stay away from bee pollen. Don't put it on anything. Stay away from any kind of dairy product, because that's what feeds the mold. Stay away from heavy concentrations of sugars, breads. Why? Because there's yeast in the bread, and that's going to trigger, it'll make it worse. I know I'm taking all your diet away at this point. And alcohol, particularly wines and beers and things like that, because they're fermented and they will cause you to be much more susceptible to all this silliness that's out there. So look, my friends, if you knew you could do something and get your life back, and you're tired this time of the year of being tired, being just wiped out and sitting around and not wanting to do anything and having no energy to move forward, why are you so hesitant to do it? Are you just mad at the world because, why me? Why is it me and nobody else is suffering from it? Well, it's why you, because there may be a predisposition that you neglected, that you don't want to look at. And it's much more easier to keep your lifestyle and go take the nose dope and spray it up in there and take the drugs and the steroids and things that your doctor wants you to take. Now, the problem is that the only person that's winning in that situation, and as far as I'm concerned, the only one that ever wins, if you follow that route, are the wonderful drug lords that are out there, the big pharma. They're the ones that are getting tons and tons of ka-ching in their pocketbooks. Not you, you're losing because you don't feel good. You don't want to go do anything. You don't want to concentrate. You can't focus. You can't get out and do the things that you need to do to even earn a living sometimes. It's true. I mean, when you're exposed to environmental allergens like this, and they can extend not only from what we're seeing in the environment right now, but also, look, it rained yesterday, right? And it's not so hot as they say maybe today. But why do you have to suffer with the change of weather? Why do you have to deal with, when it's beautiful out there and you're afraid to take a deep breath of air? Why are you suffering the way you're? Well, if you come in and you see me, I'm going to show you why, because I'm going to take you all the way back and we're going to look at your history. When was the first time all this started? What happened? Why have you put on a little weight that maybe you shouldn't have put on? And you have rashing all over your body, out on your legs, in your arms, on your face, in your skin. I look behind your ears, right back here, and see if there's this, mushroom patch that's growing back there, right? So you're going to look there. You're going to look underneath the neck. I'm the crazy guy that'll tell you, roll up your sleeve. I want to see the crevice of your elbow, and I'll take it and I'll bring it up next to my nose and I'll smell it. And why would I do that? Well, because I'm an old type doc, and your body gives off signals of different odors. And behind the ears, underneath the back of the lip, looking at your tongue, is it white? All of those are indicators that you are highly susceptible to mold. And you probably got a lot of it living in you. And that's why you react so badly to this environmental nonsense. And it's affecting neurological platforms, affecting a lot of different things. So look, if you had a choice to be miserable, or if you had a choice to be better, wouldn't it be prudent? Wouldn't it be prudent to see somebody about them? I think so. That's what I do. I get treated. I make sure my diet's clean. But listen, as we go through the program, we're going to talk about subtleties like bromelain and proteolytic enzymes and things like that you could use that are going to make a difference. Look, we're coming up to a break in the program, and I want you to stay with me today because I don't want you to suffer. I don't want you to have to go through, this. My head hurts, my eyes are burning, my ears, my head, everything is itching all over my body, and I don't know why. I take a shower every day. I feel good. Not so much, right? We're coming up to the break. You're listening to Ageless Health with Dr. Tom Roselle Live. I'm going to give you the keys to feeling better when we come back. Don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellcare.com.
Educate, Engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Hey, everybody, welcome back. This is Dr. Tom with Ageless Health, and we're going to get into why you feel so creepy right now. I mean, tired, and you itch all over, and you're not doing well with yourself. And guess what? It's springtime. It's supposed to be a great time of the year. Things are blossoming. They're supposed to be, out there, right? Listen, coming up next month, April 15th, at the Roselle Center for Healing, 6 p.m., we're going to be doing a night on springtime allergies, but more importantly, how you can fix them, how you can get rid of them, maybe once and for all. Once and for all. Wouldn't that be cool? I don't know about you, but I'm all in. So listen, there's nothing that can't be resolved, nothing. And everybody says, well, I have a genetic predisposition. Have you ever heard of something called epigenetics? That means that those 46 chromosomes that you have are influenced by exterior, exogenous, outside of you input. And that input can be anything from stress levels. It can be your dietary pieces, the things that you absorb in your body, all the garbage foods that we eat. And it can come from an ongoing pain that you're putting up that basically is a subtle sign that tells you that your neurological system is not working the way it's supposed to. So if that's the case, I don't know about you, but let's get it fixed, right? Let's get it done. I told you that this segment of the program, I would start getting into some of the things that could help that fatigue. The fatigue primarily comes from the fact that your fight-flight system, your adrenal system, your get up and go got up and went. And it just knocks you out. You have no energy. You're not producing any adrenaline in your body, so to speak. You're not producing the corticosteroids that your body should have. And you can't drop that inflammatory titer down to where it needs to be. So let's talk about what might work for you. All right. If you did nothing else, I gave you a little bit of a, kind of a jab early in the first part of the program. I said, clean your diet up. Don't eat the garbage that's going to make it worse right now. You said, well, I can't give up yes, you can. If you really want to feel better, you can make a decision. You can do it for the spring, right? See what happens. Challenge me. Don't do it for a month. Get away from all the junk, all the moldy stuff, the cheeses particularly. Get away from peanuts and peanut butter. Why? Because it's a mold, it's a fungus, it grows in the ground, and it acts that same way. So anything like that, anything that's fermented will cause you issues. So start with that, little subtle changes, a lot more that you can do with them. But let's talk about some of the things that if you had them around you. We're talking about, if you will, a couple of homeopathics that's probably work better than anything that's out there, and your docs are not going to tell you about it. So Dr. Tom's going to tell you about it, okay? Because we use them all the time. So there's some good ones. I'll give you the names of the companies first. There's a company called Highland. They make homeopathics, and they've got great products for sinus infections. You can get that. You can go to our web store, which I'm going to tell you about, and how to find some of these things. But Highland is one of the best companies out there. They're tried and true. They've been around for like decades. If you go into the same company that makes, if you will, the homeopathic for flus and colds, it's Boiron, Boreon, and they make one for sinus relief and so forth. And these guys are not going to hurt you. There's several out there. So how are you going to find them, right? What are you going to do about them? Well, one of the ways that you can find them is you go to rosellecare.com, or you go to drtomroselle.com, and you're going to click on the website. Okay, step one, you're going to click on the website. Then you're going to go to the top of the toolbar, and you're going to see Ageless Health Store, and you're going to click on that. Then you're going to go down, and you're going to look at there's three little blocks there, and you're going to look at something called Full Script. There's where you can find all kinds of really good stuff that we use with our patients. And if you can get stuff from us, but if you're not a patient, or even if you are a patient, go there and check it out and see if you can find them. If you can't, call the office and tell them to ask me, and I'll tell you how to get there. But there's some really decent products that you need to be aware of. So look, here's the deal. What can you do other than that? Lots of stuff, my friends. There's a lot of stuff that you can do. You have to be willing to step up. All right, we're going to take one. So there's something called quercetin, and it's spelled Quercetin. Quercetin. It's a flavonoid. It's called a bioflavonoid. And quercetin is found in a lot of different things, from apples to berries to onions, but you can't get enough of it. But what it does, it stabilizes mast cells, which causes histamine to increase. That's what mast cells do, right? And so you go to the docs now, they got this big thing. Well, we have to stabilize your mast cells. Most of them don't know what the heck a mast cell is anyway, but some drug company told them to take this and tell your patient they got this mast activation problem and they need to slow it down. So mast cells, okay, they can cause an inflammatory reaction, histaminic patterns. Now, how much quercetin should you take? Well, there's some friends of mine that are MDs and researchers that would tell you, just take a handful, you'll be fine initially. Well, I'm going to tell you dosing that you maybe not take a lot of it, but start out with maybe 1,000 milligrams, 1,000 milligrams in a straight situation, 1,000 milligrams, and you want to take it about 4 times a day, maybe every other hour for the first day, and then go down to maybe 3 a day after that. And often quercetin is combined with other bioflavonoids and digestive enzymes like bromelain. Bromelain, by the way, you can find in pineapples, and it's a great anti-inflammatory. It works really, really pretty well. So if you didn't do anything except for that, that would be great. It would work really well. It drops down the inflammation. It helps you with your sneezing and that stuffiness and that congestion that you have in your head and itchy eyes and so forth. It actually makes a big deal. Now, if you want to clean out the nose, there's a couple ways to do it. You can get in the hot shower in the morning and then blow your nose out. And you can go get a neti pot if you want to. Neti pots work beautifully well. You can get them at most health food stores, and that will help you do it as well. But you can do the shower. Just get in there, breathe in that hot steam, and then just blow your nose. Let it go down to the drain. Just hold one nostril, blow hard, blow hard, and shoot it out. Don't snucker it back in. So do that, right? Okay. The next thing is something called stinging nettle. The actual name for it is Urtica, I think. Yeah, Urtica dioica, Dioica. Yep, I remember. And it will help clean your nose out. It'll clean that nasal inflammation. You want to take somewhere in the neighborhood of about 600 milligrams 3 times a day to begin with. And if it's really bad, if it's not, you can take about 300 milligrams a couple times a day. And again, these things will not hurt you. Otherwise, I wouldn't be telling you on the air. There's another one called butterbur. And butterbur's been shown in tons of clinical trials to be very effective as an antihistamine for hay fever. Now, you're saying, well, that's for the fall. No, it's the same symptom process here in the springtime as well. Do about 50 milligrams of butterbur 3 times a day. Again, you're not going to get in trouble with this. Otherwise, I wouldn't be giving you. Vitamin C, load it up, my friends. Vitamin C acts as a very strong natural antihistamine and antitoxic element. It supports your immune system across the board. So what do you do with that? You know what? I would just tell you, go get a good natural form, and take one every couple hours. So maybe about 3,000 milligrams a day to begin with, then get it down to taking 1,000 milligrams. But you don't want it all at once, right? You want to take 500 to 750 milligrams. Why? Because your body takes what it needs and then you urinate the rest of it out. It's water soluble in the system. Now, you also need to get a good probiotic. And all these things that I'm telling you about, from quercetin and butterbur and vitamin C and probiotic, you can go into that site that I just told you about, right? You can go in there and you can find them. Just go into rosellecare.com or drtomroselle.com, and then go to Ageless Health Store and go to Full Script, click there, go in, and you'll find all the things that we're talking about. It's very, very important that you put the fire out, because it gets worse. You feel miserable. Well, who wants to feel miserable? We're going to talk about other things. There are things that are very specific for a lot of people. I don't want to kind of broad brush things if I don't know what your body's doing, but your fight-flight system, your adrenal system is critical. Your vitamin C will help you with that as well. Did you know that if your adrenal system's not working the way it's supposed to, and it's being overridden by this nonsense that's out there that can actually affect your blood pressure, the inside of your adrenal system is called the adrenal medulla, and it produces something called catecholamines. And these catecholamines will affect blood pressure and heart regulation and so forth. So knowing that, we need to support it. Your vitamin C will do that. That's one of the things that you can. Something called L-tyrosine, T-Y-R-O-S-I-N-E, tyrosine, will also help support that. So here's the deal, right? Start taking little bits of these things. See if it works. Get your nose nice and clean when you're in the shower. It's easy to do. No big deal. Or go get a neti pot. Spend your money on a neti pot. Just get in there and just, do that. But I get in the shower in the morning and I suck in all that hot water before I turn it on ice cold, by the way, which I do. It's called a health hack. And I blow my nose and I clean out my head and I'll blow out whatever's left. So if you do that, and don't be snuffleupagus, right? What I'm talking about there, you suck it back into your head. Don't do that. Don't do that. You're just making things worse. You're plugging your ears. You're putting pressure in your head. You're making it worse. So do it the right way. We're going to clean up our diets just a little bit for this time of the year. We're going to get rid of the peanuts and peanut butter. We're going to get rid of, you can use almonds and almond butter as long as they're organic. We're going to get rid of the things that are fermented in our diet. We're going to clean those up. We're going to go to vegetables and clean meats and things like maybe a little bit of sweet potato, and we're going to do a little bit of wild rice, and we're going to do those kind of things because we want to get rid of the rest of the stuff, but we still want to eat and enjoy ourselves, right? Eggs, organic, free range, things like that. See, there's lots of food that you can eat, and you can get really innovative and make them taste really, really good. But my friends, you can beat this. I feel so sorry for patients that come in and they're breathing heavily. You can hear them wheezing, and it's not the flu. It's not COVID. It's not any of the nonsense that's out there. It's the springtime allergies. So let's get them fixed. We do things in the office on an ongoing basis with detoxification process. We'll clean the system out. We'll do things to clean the head out. We use diathermy, which is like a deep radio wave, and to open up the chest and break down the inflammatory reaction. We use pulsar frequencies that are like a radio wave, like you're listening to right now. But it's very specific to normalize the tissue. See, the body wants to heal. It doesn't want to be doped up. So if you have the tools to heal it, then why not use them? I don't know about you, but I'm always looking for the good stuff, things that we can do to make a difference in our lives. If we're talking about homeopathic preparations and so forth, there's a natural medicine, believe it or not, for infections, sinus infections. It's belladonna. Belladonna will kill you. by the way, if you took it straight. But in homeopathic forms, it blows sinus infections to smithereens. It gets rid of, there's no side effects. None. There are no side effects. It will make a huge difference in how you feel. There's another company that you can look out there. It's called Banyan Botanicals. Very organic, some of the best products out of the market. But you can look them up. They're all online, and then you can go to, that site that I just told you about, right? You remember? Full Script, and check it out and see what's in. By the way, remember, if you're having problems, you want to reach out to one of my doctors and have a brief courtesy conversation. They'll do 20 minutes as a gift to you. Go to the website, go to rosellecare.com, rosellecare.com. If you don't know how to spell my name, that's shame on you, but it's ROSELLE, Roselle Care, CARE.com, one word, rosellecare.com. And call the office, 703-698-7117. Tell the staff that you want to talk to one of our great docs. And these guys are amazing. I mean, they truly are amazing. So if you know that you can get some help, reach out for it. You're not losing anything. This is not a timeshare. This is giving you the tools that you need to have to make a difference in your life. Now, we'll give you another clue that really works pretty well. There's things called proteolytic enzymes. And I talked to you about them before. And bromeline's one of them, and amylase is another, and so forth, right? Well, proteolytic enzymes will debride all the nonsense and open up sinuses and all kinds of other tissues in the body and so forth. So a proteolytic enzyme is any group of enzymes that break down these other molecules of bad proteins, okay? And they break them down into shorter little segments. They're called peptides. And they eventually end their subcomponents of amino acids. And the process, if you want a big word, is called proteolysis. But all that really means is that is breaking up this nonsense that's irritating you. We're going to get a little bit of that in the last part of the program. I want you to know what they are, the trypsin, the chymotrypsin, the amylases, and so forth. All of these guys really are natural products that work so beautifully, so magnificently in so many different cases. Even with cancer patients, but we give them very high combinations, if you will, of different proteolytic enzymes on an empty stomach. And you can take these on an empty stomach, by the way. Don't take them with food. Why? Because they act as a digestive enzyme. So you want to be able to break down these proteinase products that are irritating the tissue, that are causing you the swelling, the itching, the stuffiness. And remember, what the thing that makes your head feel like there's an elephant and it's sitting on it is all this inflammation in the soft tissue. The tubes in your ears, they're called eustachian tubes. They enter in your throat. But if the spinal segments are misaligned, that eustachian tube can't open and close properly when it's irritated to drain all the other nonsense that's in there. So you end up getting ear pressure. Your children, the little guys, when they're exposed to this thing, they hurt like crazy. So then you go to the doc, what do they want to do? They want to put tubes in. No, you don't put tubes in. You bring them to somebody like me and you have them checked out. You can turn that silliness around very, very rapidly, providing that you want to do something to help support that. Like what? Like get rid of the damn dairy products in your children's lives. Dairy is one of the worst things that you can put, unless it's free range, grass-fed, raw milk, and it comes from a goat. Why a goat, do you say? It's because it has the molecular structure that's the closest to mother's milk. But the rest of the stuff, you're putting cow's milk in, particularly after it's been homogenized and all the nonsense that's been put in it, it causes a reaction and actually pulls calcium out of the bones. Yeah, you heard me. So, well, I drink milk because of calcium. No, it's the worst thing that you can do. Don't put that in your body. And, we should talk about that one of these. You know what I miss is having this program call in, where you can pick up the phone, you can call me, and we could go over your questions and so forth. That's fun. I enjoy doing that because then I get to know your products. But you can send me that information, and we'll do a mailbag, right? Send it to me and we'll answer you directly, but I'll also talk about it on the air. And, by the way, if you don't think I'm telling you the absolute honest to God, straight up, this is good for you truth, challenge me on it. I'll show you where you get the data. I'll show you where to get it. When we come back, after the break, we're coming up in just about a minute here. We're going to kind of recap a couple of these things. I'm going to tell you some of the things here, but I want you to remember that coming up at the Roselle Center, April the 15th at 6 p.m., we're going to talk about allergy reactions. And we're going to give you tools. We're going to show you how to fix it. Maybe once and for all. Maybe get your life back. Wouldn't that be great? Instead of suffering in the spring and suffering in the winter, that you're good all the time. I don't know about you, but I like feeling good. I like to go out and go for long walks. Some of you come back in. I can't go for a walk. Why? Because I come back in, my head feels like it's going to explode. Well, there's ways of fixing that. Truly. Listen, we're coming up to a break real quick now. I'm going to give you things to do. And if you don't do them, it's shame on you. You're the bad guy, but you don't have to be, right? You're listening to Ageless Health with yours truly, Dr. Tom Roselle. Don't go away. I'm going to wrap this all together to you and hand it to you so you can help yourself. We'll be right back after some very important messages.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey, everybody, welcome back. You're listening to Ageless Health with yours truly. What a program to start out the springtime with, right? What did we say? We said, this time of the year, there are subtle pieces of the puzzle that start sneaking up on you. And the one that really most people don't realize is the fatigue, the tiredness, oh my God, I can't function. I can't do anything. We think that it's because of the time change. It's not. It's because you're sensitive to everything that's out there. It just kind of blows your socks off. It's your fight-flight system. Your adrenal system's not working the way it's supposed to. It's not producing the steroids that you need. It's not producing digestive enzymes that you need to make a difference. And you can actually make a huge, immediate shift and change. How do you do it? Well, we talked about a lot of it, right? We did a lot of it. 1, get rid of all the junk in your diet. Get rid of the peanuts and peanut butter. Get rid of the fast-acting foods. Start eating fresh, whole foods. Get rid of the dairy is like one of the worst that you can do. Stay away from the wine. Stay away from, the fermented beers and so forth like that. Get rid of them. You're doing too much of it. That's why you feel like hell. You don't need to. It's not okay. You weren't supposed to feel that badly. Now, look, if you give yourself a little probiotic, you get the proteolytic enzymes out, the bromelain, the papains, and so forth, and you take them on an empty stomach. You start cranking up your vitamin C nice and high. You take a little tyrosine. I promise you, the quercetin, the vitamin C, just doing those things, but you did them heavily to begin with. You got rid of some of the dietary indiscretions that you had. I promise you, you will do far better than you could possibly imagine, and life will get different. And if you really want to get it fixed, you call the office, give us a call. This is what we specialize in, is turning bad stuff around and making it a whole lot better than you possibly thought it could be. So let's walk through that puzzle. Remember, on the 15th, we're going to get into it in depth, 6 p.m. at the Roselle Center for Healing. Join me. I'll be there with you that night. And we'll go through this whole process and give you data and show you what we can do. By the way, we're really celebrating something very special at the office. And that's announcing a new addition to our great professional staff. And what am I talking about? We got a new nutritionist. Many of you were patients of my wife's platform for years, and Sue's probably still, as far as I'm concerned, one of the best in the business. But she decided, it was time to be a professional grandmother. But we had a couple of people with us that were good, and then they left us. But trying to find the right fit for our practice, for a biochemical, biomedical practice, is a challenge. But we found one. We actually found 2. But we're starting one first. Her name is Kisha Henry, Kisha Henry. And this woman is more credentials than you can possibly shake a stick at. Her expertise is in hormone therapy and perimenopause and insulin resistance and metabolic health and so forth and so on. And so give the office a call. Make an appointment with Kisha. All you got to do is 703-698-7117. So if you thought that, oh my God, where do I go? He's telling me to do all these things and I don't know where to start, call and talk to Kisha, make an appointment with her. And I promise you, she'll walk you through it. She'll show you how to detoxify the system. She'll show you how to clean things out. She's extraordinary. She's really top shelf. If you want to talk to one of our doctors, all you have to do is call the office. Again, 703-698-7117, and say you'd like to talk to somebody. It's a gift. It's our gift. It's a free 20-minute consultation. Give them a call and say, hey, listen, they're open today. They're open until, I think, 1 o'clock. So give it a call. And if they're with patients, obviously they're not going to be able to talk to you, but they will call you back. And they'll make that happen. They'll do it very quickly. They'll tell you exactly what needs to be done step by step. And then you get to choose. You get to decide what the deal is, but they'll give you some data, some things that you can apply, like right now. Look, you need to take control. Why be irritated when there are things that you can take, from quercetin to, we talked about butterbur, we talked about vitamin C, we talked about probiotics, we talked about stinging nettle. We talked about keeping that nose clean all the time, washing your clothes. Get an air filter. We have these little plug-in air filters that you can have in your house, and they clean everything up real quickly. It makes a huge difference. You can wear a mask. If it's that bad, go get a surgical mask. But remember, It's not there to protect you against a virus. It's not. A surgical mask will get rid of all this silliness that's out there. Put sunglasses on so you don't have the ongoing blow in your faces. But, clean your clothes up. Don't wear the same thing every day. Don't re-expose yourself to it. There's so much that you can do. Love yourself. Love yourself enough to make a difference. We have a product called Air Tamer. You can go directly to our site again, and Air Tamer will purify the air when you wear it. Those guys will get rid of viruses. I wore that during COVID. I never took it off when I was with patients. I never wore a mask. I was with the crazy boys, right? Because I knew it wasn't working anyway. So I'd walk in and I'd tell the patient, hey, listen, I'm not afraid of you. That's supposed to protect you from me. Just take it off. You see what I'm wearing? And then we have all these plugins around the room. I never got sick. And I'm one of these boys that didn't get vaccinated. And I never stopped traveling. I was teaching all over the place. So there's things that you can do to make a difference. So take control of your own life. Remember, Ageless Health. Health is a do-it-yourself program. My old book, which we're in the process of updating, you still get it in the audio version. So you can go to Ageless Health, and I think it's agelesshealthbook.com. Check it out. Or you go online. I think we still have it there as well. And listen to me tell you what you can do. Health is a do-it-yourself program. It's in your hands. It's all about you. Or you're going to sit there and complain and be miserable and have the pressure like an elephant sitting on your head on an ongoing basis. I don't know about you, but that's not the journey I want to take, particularly when there's things I can do. But in the short term, right now, to help yourself, get in that hot shower in the morning and clean that nose out, those sinuses, blow that stuff down the drain. Second thing you can do is what? Do the proteolytic enzymes, do the vitamin C, hit that quercetin level nice and high. Get rid of the things that are fermented in your dietary pattern. Take that probiotic. Make sure that you're extremely well hydrated, by the way. Drink water all day long and keep getting that stuff out of your pores. When your skin is scratching and itching, it's breaking out, and you've got this eczema that just won't go away, don't you think it's time to take some action about it? I think so, because I don't want to live that way. I don't want that elephant sitting on my sinuses. I don't want my ears plugged up so I can't hear anything. I don't want my eyes so bad that I want to rip them out. They're itching all the time. I don't want my skin to, look like somebody parade ground through it. So if you can do something about it, do something about it. Let us help you. All you got to do is reach out, make an appointment with one of my great docs. They're amazing at the work that they do. They truly are. We've got a team that I am humbled by on an ongoing basis. Really extraordinarily good people. I walk in and I say, wow, guys, teach me something. And the beauty is that we do go back and forth, and I'm, being a little down that heavy path right now, but these guys are amazing. From the things that we do without drugs, wow, no drugs, no surgery, no steroids, no pain medication, and you can resolve a problem and get your life back. And, I'm not going to tell you that dietary patterns should be used to lose weight. That's not the deal. You can lose weight if you clean your diet up and eat the right things. So let's put it in a different vernacular. That extra 40, 30, 10, 15, 50 some that you have around your body in different places is there just simply because that you're not eating properly. And your body's reacting by putting inflammation, swelling, cortisol into different tissue. But if you start changing things and you had good digestive patterns going on, your microbiome, all the good bacteria in your gut was working, not only would you get rid of all this craziness that's plugging your head up and the itchiness that's going on and the fact that you can't hear squat anymore because you're always irritated. And that's, by the way, one of the reasons that you lose your hearing too, is the allergens out there. But you'd be surprised what comes off the system. You'd be surprised. I want you to go out and be able to walk outside in this weather. I want you to enjoy it. I want you to open the windows and smell the beautiful rain as it begins to clean things up. That's my gift to you. And when I say that, it's truly a gift. It's trying to get you to understand that you can change virtually anything. And don't forget, through Caring for Others, a foundation that we support, we do outside events for your organizations, your churches, your clubs, and so forth. All you got to do is call us, 703-698-7117. And there's absolutely no charge. Remember, I'm here every week for one reason only. I love you all. You have a great day. See you next Saturday. Bye.